What about the like cracked heels? I mean, that seems to be something that ladies deal with on a regular basis. What is the cause of that, and how do they properly address it?
A common podiatric problem, we see it probably every day in our office. Combination of very dry skin coupled with excessive callus buildup and mechanical pressure. An analogy I like to use is it's sort of like having a tomato on a counter and you're pressing down on it, and eventually the tomato bursts and cracks at the seams. That's very similar to what goes on with a heel. When you put your weight on your heel, the fat pad below tends to push out laterally, and if you have that dry, cracked skin, very easy to crack. It's at least a cosmetic problem and a nuisance, but it can very easily get worse. Those cracks can go deep and get painful, and even introduce either fungus or bacteria. So it is a problem that should be taken care of.
How do you, what type of products do you have that help these kind of situations, and how are they different than what you might find over the counter at a drugstore?
Yes, we do have a very fine product specifically for cracked heels, but it also works good with calluses and corns as well. We call it cracked heel repair cream, and it's a botanical formulation, has about 50 different ingredients in there, and they all do different things. First, we have a humectant in there. A humectant is ingredients that actually draw moisture from the atmosphere and the underlying dermis, so it rehydrates the skin. We have emollients in there, which smooth and soften the skin, and it forms a protective barrier to disallow evaporation of the moisture we do have in the skin. It has a combination of what are called keratolytics in it. Keratolytics are ingredients that actually dissolve keratinized tissue. And we also have some essential oils that are antifungal and antimicrobial in case the cracks are deep, and so we can kill the fungus and bacteria that way.